Start?
We are live.
Yeah. Namaste. A very good evening. This is Dr. Archana Dwivedi, Midlife Management Committee Chairperson, inviting you for a great evening ahead where we join together for Gyan Pravah episode 231, where the Gyan flows from different specialities. We have our guest today, Dr. Geetika Madan Patel, and welcome Geetika ji. And I would take the privilege to congratulate Dr. Professor Sunita Tandulwadkar, Madam, on this 231st episode of Gyan Pravah. Madam is not only a visionary leader, exemplary in her academic performance, at home front, everywhere. We had a little peep in last month through her personal life, and I got to know how organized people can be. So that is what is a learning experience, Sunita ma'am. You are always there. I would not read the CV because you yourself is epitome of strength for all of us over here. And Geetika ji, 35 years of hard work, vision, and great amount of work what she has put into the academic career. I think these awards, September has been great for all of us. She got RCOG fellowship. That is why I call her professor right now. And back to back, within I say 24 to 48 hours, she was also honored for her Sampurna CME project. Sampurna is where Madam says, be ready for your pregnancy. No pregnancy should be unplanned. You should be mentally, physically, spiritually ready to become a mother. So thank you, Madam, for giving us this proud moment this September. I started with my birthday month and it has been a celebration already. So that is what a leader should be. And today we'll be discussing with Geetika ji training of the trainers. So let me tell you, we have a great leader on this platform, Dr. Geetika ji and Sunita madam. And Sunita madam, President Fogsi, she has been a transformational leader with empathy, integrity, resilience, which flows in all of us, navigating, balancing all of us, all the 30 committee chairpersons in the form of this podcast, which we are talking today. And we are developing ourselves not only on the national but global perspectives. So when Madam is here, I think I should shut my mouth and let her speak for the
No,
words
Archana.
because it's
No,
always
Archana.
flow.
These podcasts are meant for you all to speak.
Yes,
That
yes,
is just for you and not for me or about myself. This is completely the chairperson using their own creativity so passionately. You people select all the faculty from different fields and try to make your own podcast better than the last one. What amazes me is the 30 chairperson, they don't compete with each other. They compete with their previous podcast only. How my next podcast, how I can be different, how and where I should take my dialogues or an interview or this podcast. So that's a beautiful creativity and learning the leadership, because I think if you all decide, you are the future leaders of Foxy. You are on a first phase and automatically you will keep on climbing, provided you have that desire to become, because you need to give a lot of time for Foxy Presidential. It's not an easy job, but definitely it is a rewarding job. And Archana, every one of you have a capacity to do so. If I can do, you can also do. And I'm so glad today you got Dr. Geetika and you are talking about training the trainers. That's a fantastic thing. And that is what we are doing, developing more leaders and not the followers, as I always say. So I'm sure we will enjoy your podcast. And Geetika ji, our pattern is only you both will be in the frame and I will be listening to you all from the viewers link like others.
yeah. Thank you so
Lovely meeting you.
Thank you, Sunita
Same-
ma'am. Just a
same.
moment to introduce Geetika ji, because when we talk of two beautiful ladies in front of me with vision, inspiration, collaboration, advocacy, and empowerment, these are not big words. They have lived their life with this and they have set an example. Moving forward, let me introduce Dr. Geetika Madan Patel in a formal way. She is a Vice President of Parul University, Chairperson of Shaktimanand Foundation, Founder, Total Health Solutions, Medical Director, Parul Sevashram Hospital, Managing Trustee, New Era Senior Secondary and Anand Vidya Vihar School. So from schools to college, she is heading all of them. She is vice president of Parul University and the medical director of the university oversees medical and paramedical education across various health science courses as well as administration of 850-bedded Parul Sevashram Hospital, a tertiary care center as a teaching faculty. Her commitment to quality healthcare has propelled the hospital to become one of the few teaching hospitals in the country to achieve NABH digital and NABH accreditation, serving approximately more than 7 lakhs outdoor and indoor patients annually from Gujarat and neighboring states. The hospital has also established peripheral health centers in rural areas, including Halol and Padra, as well as in Vadodara city, to extend its reach and to help the people getting the facilities at their doorsteps. She's also engaged actively in national and state committees such as ICC and Healthcare Committee and AHPL. Also, she's a chairperson and founder of University Foundation and two prominent CBC schools she's already heading. Lots of awards and accolades to her. She is featured as Women Leader in Healthcare and Women Entrepreneur magazine, felicitated among the top 100 Women Icon Awards by India Prime Awards, felicitated as Women Entrepreneur of Vadodara by Times of India, and also felicitated by Times Power Women Award 2021 for her contribution to medical science and public health. She was also felicitated Women Eminence Award by Mantavian News, felicitated as Top Impactful Hospital Leaders of 2023 by Voice of Healthcare. She has been participating as panelist in many relevant national and state level talks and seminars and relevant topics. Recent ones is e-conclave on India versus Corona 2.0 by ABP News at national level, QSI Gauge National Conclave, ICC National Healthcare Conclave, and AHPI, that is Association of Healthcare Providers of India Conclave. She has also been an active person as a panelist in re-architecturing the health work models for 2021 by Voice of Healthcare. With so much applause, and she is also a good friend and a very down to earth, humble human being, I would say, madam. Anytime you can approach her, I think one ring and she always attends the call whenever I will call her. So that is a true leadership she has been exhibiting all these days. So I think we'll start our podcast with Madam's blessings and with Geetika ji in the frame, training the trainers. When we talk about the doctors, I mean, Sunita ma'am, you'll agree that many of people have so many potentials. And whenever madam says, you are my leaders, I think that gives a different lift to us. So similarly, when we were discussing about this topic with Geetika ji, we found that many people having the potential still when they are standing in the public front, there is a lack of word. There's sudden thing which there's a blow, they're not able to speak up for themselves or whatever is going on their mind. So that is what is we need to address to make a good leader. So here,
Thank you, Archana. Enjoy your podcast and wonderful meeting you, Geetika ji.
Same here.
We'll definitely meet sometimes in person.
Sure.
Thank you.
Thank you.
Bye.
Thank
thank
you.
you, ma'am. Thank you so
Bye,
much.
Archana.
Bye. So when I talk about the leadership, Geetika ji, uh, see, I'm a clinician. I practice in a clinical setting where I am like seeing patients from all public front, like from a lower socioeconomic status, from middle class, upper class. So in my clinical setting with the staff from different class and creed, how do I define the leadership and how the leadership looks when I sit in the clinical setting and want to practice in a better way?
Yeah, so I think Archana ji, healthcare leadership is it's not that simple as any other leadership, and in a healthcare setting, it is a little complicated. So I would equate it with a bunch of wires, if you can imagine. एक गुच्छा है wires का and it's entangled out of the sockets and not generating any electricity. So a healthcare leader is somebody who would calmly and peacefully, sort these wires, plug them to the plugs, and then this entire group of wires still stays together and generates electricity. So in healthcare setting, it's immensely important for a doctor to be a healthcare leader as well, so that whatever the doctor is expecting out of the entire work that is being done, the entire team stays aligned and focused towards the same objective. If everybody is working on a common objective, then of course the results are bound to be great. Otherwise, if everybody is working in their own directions without the common goal and focus in mind, it's really difficult to attain the desired outcomes and objectives. And that is how a doctor, as a healthcare leader, a team leader, brings the difference into the healthcare setting. So healthcare leadership, I think, is something which does a 360-degree, makes a 360-degree difference in a setting. And that's how it's immensely important for all the doctors to have a component of leadership as a quality to be imbibed in their personality. That is something extremely important.
So I think I'll correlate what you said, that you are a tree with the deeper roots and you are supplying your branches to establish a better growth and better fruits as a form of outcome.
Correct,
I
very
think
true.
you defined it so well. But now there is a doctor who is like going into a transition phase as well. So how can doctor transition from being an individual contributor to effective team leader? And there are so many challenges we are facing daily. So how do you feel that they should be guided, or what should be our perspective when we want to develop ourselves in this way?
So, that's very correct, because when a doctor transitions from the medical education immediately after completing post-graduation, there is nothing like an administration which is taught or which is learnt. A postgraduate student is always supposed to follow what is being told by the seniors, by the professors. He or she is supposed to give the exams and then upfront right away go into a healthcare setting where he is either a leader or, he or she is trying to establish something of his or her own, or in a hospital where a leadership role is given. So definitely there are challenges. However, everybody needs to understand that leadership is a journey. It's not something कि आज हमने सोच लिया कि कल से हम leader बन जाएंगे and it's going to happen. It's not like that. So it's like a seed, which is to be nurtured with continuous nurturing, a lot of water, a lot of support from outside, and then you eventually grow and become a leader. So for a doctor, I feel that what is most important is to understand that he or she is never going to work, never going to be successfully working in a healthcare setting alone. So what is important is to understand the role of every single teammate who is working, be it a junior doctor, be it a nurse, be it a paramedic who is working along, and to understand that he is like, I can equate this like he's a conductor of an orchestra. We have seen like how the orchestra plays. There is a conductor who's defining and controlling everything, and there are so many people who are playing their musical instruments. Now just imagine if one or two of those people start playing a different note which is not in sync with the that pitch and that tone. So what will happen? A disaster, right? It is a pain to the eyes. So similarly, a doctor has to keep, as a leader, an eye on what everybody else is also doing. For example, if I as a doctor has planned something for the management of my patient, and a nurse is not in sync with what I've planned, what is going to happen is completely the outcome is completely going to be different. So for a doctor, it is very important to be able to understand each and every teammate's roles, cite his or her expectations out of them very clearly, very explicitly, and then make sure that everybody is working towards this common goal, and he is the one who's the conductor of this orchestra. Once this symphony and synchronization is attained in the team, then the team obviously does wonders. So if everybody is working and playing different notes in an orchestra, then the same thing happens to the patient outcomes when we are not synchronized towards the common objectives. It is, of course, challenging, but it is not something which is impossible, because leadership is learned out of your own experiences. A lot of self-reflection helps. So if something did not work today, that doesn't mean that it will not work tomorrow. So you should learn out of your own experiences, self-reflect that where did I go wrong today and how I can make it better, how I can make sure that my team is gelling with me in every single thing, how I can make sure that I do a 5-minute morning meeting each day, make sure that I summarize what are my expectations, I cite them clearly to my team. And then, there are miracles which I've seen happening when the doctors are trying to do this improvement every single day.
I think it was completely in sync what you said, that whenever a young guy or a girl passes out with the white apron in his or her hands, suddenly the world opens, and from the college cocoon, it has to turn into a butterfly. But being a butterfly, spreading your wings is very hard. We all know that. And you rightly said that the talk therapy, 10 minutes talk to your own employees, will do the wonders. And very well said in the form of orchestra, as you said, we have people who think in different direction. You may be having a staff of just 5 people or maybe 500 people, but everybody is competing with everybody and to orchestrate that in a straight manner. So I feel there should be a training module, ma'am. So how do you think, like, do you think there should be an inculcation of this topic, being a leader, how to manage things in a better way, standing in an upfront position where you are being looked by other people as a role model? So do you
Yes,
feel?
of course. Yeah, so there are a lot of changes which are happening in the medical education structure in the last 5 years, I would say, and a lot of modules have come in additionally, which I mean, me and you, we never studied. So, like there is an attitude and communication module that has come up in the NMC's curriculum framework today, where the doctors are actually being taught that how to communicate effectively with not just the patients but with the relatives, with your interpersonal and the communication with other health professionals. This has been formal trade. This is a part of formal training now. But leadership module, yes. So I would like to cite here that we as an organization has taken this initiative and we have introduced a leadership program for our undergraduate students. However, it has not come professionally in the training, but we have identifying certain qualities in certain students. We made a batch of 30 students and we did leadership trainings with them. Basically, these are a kind of simulations in which they are given some situations and they are made to understand the situation and then deliver that how they would respond to these situations as a team. So these simulations always work in teams. They are made to form teams and they are made to correlate and work in the team settings, and then they are supposed to present however and whatever the situation analysis and outcome they have done. So such kind of training programs are great help in training the students and making them understand the concept that why healthcare and why in medical education, medical profession and medical practice, teamwork is very important. So the most important thing is teaching them teamwork. If not leadership right from the undergrad days, but how to work in team, how to solve the differences, how to accept the differences at times. बहुत बार ऐसा होता है कि differences हम solve नहीं कर पाते, हम completely resolve नहीं कर पाते. The way you think, I might not be able to align it completely with my thought process. However, one has to learn to deal with the differences and still keep moving ahead. So जब हम team में काम करते हैं, then we eventually understand that what the other four people are thinking, and still we stay together. We bind ourselves together in the manner because the larger objective is similar for all of us. So the most crucial thing is कि हमारा जो larger objective है वो define हो पाए, which usually in the healthcare setting is the best care and the management of our patients. एंड उसके बाद जो थोड़े बहुत डिफरेंसेस हैं उनके साथ हम डील कर सकें, कुछ चीज़ों को हम लेट गो कर सकें, कुछ चीज़ों को हम एक्सेप्ट कर सकें, बट स्टिल हम साथ रह सकें. So that is what is can be taught in team building exercises. Now a lot of topics are also being taught in this manner. In the classrooms, teams are made. They are made to do group studies. They are made to do form groups and then present cases in the form of groups. So ये करते करते जो students हैं उनको काफ़ी सारी चीज़ों के बारे में exposure मिलता है, that how it is important to be in the team and still be able to work out things. So in the formal education, of course, it is extremely important. It's coming gradually. However, institutions can also take their own initiatives and introduce these programs. Many institutions like us are doing this in a formal structure.
Yeah. I think when we were in the schools, we made to make a group and do treasure hunts.
Yes, very
That
simple.
was for fun. That was for fun. But I think that is the time when we used to unite, have our own differences, and then ultimately treasure has to be our goal. So I think that is a simple thing we used to do in the schools. Then later on, it becomes little more complicated. And you said mock drills and putting yourself into that situation, and then your brain, how the things respond and how do you manage. That is one thing which is very important aspect of training, as you rightly pointed out. If I have to look to your life, madam, that there must be some scenario where you were bound to take the leadership completely unexpected, out of the blue moon. Something happened and you had to just take over the things in your command.
Actually, yeah, majority of the journey has been like that. So you know that our university is basically run by a family trust, And I became a part of the trust in the year 2000, right in the year 2012, when I finished my post graduation. So when I finished my post graduation, and everybody felt that I should become a part of the family organization. And when for the first day I went to the university, that time it was not a university, it was a group of some few institutions. And the first day I was like, there's a hospital which is getting constructed, so you look after it now. I mean, so that was my first day, and I had no clue on how to run or manage a hospital, because I have done my community medicine post graduation, in which you hardly go to the hospital. You just go for a curative and preventive OPD for some days. Rest of the time, you are either into field or you are into research. So I was clueless about how to run and manage a hospital, and that was the first day, first couple of days. Then, of course, things came up just like that all the time. So managing a hospital is something which I learned out of, I would say, my own experiences and out of every single person who worked in the organization, right from a ward boy to a nursing staff to a doctor to the administrative staff. I learned from everybody. And that is how I enriched my knowledge bank. And I learned out of my own leadership journey that how to become a better person, how to become a better leader. A very similar instance I just recall is a couple of months after I joined the organization. What happened was there was a group of students who were supposed to travel to Germany with somebody, with the leader of the university. However, there was some sudden change in plans, and that person couldn't travel. So it was me who was supposed to travel with them. These were all postgraduate students, and I was also almost an equal age. So I took that tour to this country, Germany, and then I had to meet the rectors and the presidents of multiple universities there, who were almost 30, 40 years older to me. And I managed to do it quite well. So in leadership, what happens is you have to accept whatever comes to you. And you have to, take this as take that as an opportunity. Sometimes it happens to it that we feel that, we might not be able to do justice to this because we do not have sufficient experience. However, if you stand in front, you accept that, okay, fine, this has come to me and I will do my best. That is how you eventually turn up growing with your own experiences. That's something very crucial in leadership. Whatever comes is take this as an opportunity. Success or failure doesn't matter, because these are all transitory. So whatever failure also comes to you will eventually give you more learning than the success would give you, right? So giving your best is something we should always focus on, I believe. And that is what I have kept doing across my journey.
I think life is never a fairy tale theater. You have to come and stand. I know that's a very difficult thing when you walk the ground where you are still trying to catch up with the roots, everybody looking up to your expectations. And you rightly said that you learn from a ward boy to administrative staff, because every individual has something to give to you. And every individual does teach you some lesson where you need to learn, let go, and move on forward. So that is one thing which very rightly said by you. But as a busy clinician, if I have got a OPD of 100 waiting outside, so that is my clinical stability. But simultaneously, a doctor has to run leadership also, because there's a staff he or she is governing from inside the OPD, that delegating this job, that job to be done by you. Patients, staff, your surgical skill or your medical skill, and your diagnostic brain all are intersecting. So how do you cope up with that type of pressure situation where you are, like, I would say, multitasking, sitting on one seat, where you are handling like a juggler everybody. So do you think that clinical and this aspects to intersect?
Yeah, so no, I recall when you're talking about this, I recall a very something, which I felt was a little awkward as a doctor, very busy in seeing patients in the OPD, just suddenly got a call that there's no water coming in the labor room. And I was really astonished to see that how, one person can deal with all of this. So what I believe here, what is important is for a doctor to be able to structure the team. Something which makes great importance is to empower certain staff who are in a capacity wherein they are not in direct dealing with the patients, and to empower them and delegate effectively so that they are able to sort the basic things and everything doesn't come to you. I've seen this happening in a clinical setting where the doctor-led nursing homes or doctor-led hospitals, everything is being, for everything, people are calling the doctor. there are say 10-15 staff in the hospital. Sometimes the doctors also feel कि कुछ भी है मुझे तो बताना है, मुझे बताए बिना कुछ नहीं करना, you know. So what happens is when we try to take too much on our head, eventually it's a lot of stress that comes to us, and we are not able to give justice to neither to the patient nor to the administrative duty. So sometimes it becomes very important to give small stuff to your staff, to the people who are working with you, and entrust them with the responsibility. काफी बार क्या होता है, हम काम दे नहीं पाते बिकॉज हमें हमें इंटरेस्ट नहीं करना होता किसी और को, कि उसने कुछ गड़बड़ कर दी तो हम जब तक डेलीगेट नहीं करते, इंटरेस्ट नहीं करते किसी के ऊपर काम, तब तक हम जज नहीं कर सकते whether that person will be able to do it or not. So the first thing which is extremely important is to stratify that which things should come to you and which things should be done at say tier 1 or tier 2, and then I stand at tier 3. So your priorities should be very clear that when I am in an OPD or in a patient area, there should be no call which is coming to you. But if you want to ensure that, you will have to empower your staff to deal with the tier 1 and tier 2 problems. For that, you will have to give them some time, entrust them with some responsibilities, and then let only the higher things come to you. वो बहुत बार नहीं कर पाते हैं लोग, हाथ से छूटती नहीं है चीज. I have seen that but in leadership, more than taking things on you, is important to give things to people and let them learn out of their own experiences. थोड़ा सा उन्हें support करें, हम mentor करें, then they also feel good कि चलो सर ने, मैडम ने मुझे एक काम दिया है, let me try my best. But वो नहीं कर पाते हैं डॉक्टर्स, मैंने बहुत बार ये देखा है. And for every petty thing, the calls are coming to them. रात को पेशेंट ने थोड़ा सा इधर उधर खोल दिया, सर को डायरेक्ट, मैडम को डायरेक्ट फोन करना है. द स्टाफ शुड बी टोल्ड दैट ये आपको डील करना है, एंड यू ट्राई योर बेस्ट, एंड एट द लास्ट यू गिव मी अ कॉल. सो आप जब तक छोड़ेंगे नहीं हाथ से, तब तक आपके स्टाफ एम्पावर नहीं होंगे. एम्पावर वो कब होंगे, जब आप उनको एंट्रस्ट करेंगे, नॉट जस्ट पास ऑन द रिस्पॉन्सिबिलिटी. यू टीच देम फर्स्ट कि आप इस तरह से ये सिचुएशन को आपको डील करना पड़ेगा, and you try your best. If nothing is happening, I'll be there to help you, but don't, the first call should not come to you. So this is something which we need to learn कि हमें थोड़ी चीजें हाथ से छोड़नी पड़ती हैं, so that we can go to the next level and progress and grow. If I, as a leader of say 1,000-bedded hospital, if everything keeps coming to me, then it is not possible to run an organization. When we build organizations, entrustment and empowerment of our staff is extremely important. And trust me, I've seen this happening. When you start entrusting with responsibilities, people also start growing. Your staff also starts growing. उनको भी लगता है कि मुझे कुछ additional role responsibility मिला, and then they start performing better. And they वो align होने लगते हैं organization के साथ, उसको अपना समझने लगते हैं, because उनको भी कुछ core responsibilities दी जाती हैं. So थोड़ा सा हाथ से छोड़ें और हम entrust करें, then things will definitely go in the correct direction, is what I feel.
I think you have touched the right string, that we are not able to leave because you are a perfectionist and you feel that everything should go according to.
Correct.
I think we can make a chart. We can tell them this is my way of going, but I will always welcome if you have any interventions in that. So that running is very, as you say, small private hospitals where you have only 15 or 20 people to deal with. If you don't entrust them, you are already trapped with so many things, and your mental and physical energy is going to be wasted. So I think very rightly said that delineate, entrust, train, and make them more mature. Give them more perks, star awards. They all things go hand in hand, and encouragement is something which is very important when we talk about a mentorship. Thank you, Kritika ji, for very empathic. I'm at a very sensitive point, but this is very true that let go, chodo, so that other people learn and make your life more easy and peaceful. One very important aspect is that when every morning when I dress up and enter my hospital, so I feel that I am already ready, or maybe any doctor who's ready to join their own public faces where we are sitting and going every day. Do we influence our staff and people around us? And what care should be taken that the influence comes out with a positive energy? Like if I enter the hospital, am I influencing my staff and patients? And how do I make it more positive for them that I have come, now things will be all right?
See, I always believe that, doctors and teachers, these are the two people who are the real influencers in our world. जब छोटे बच्चे होते हैं, जब वो पहली बार किसी डॉक्टर को बताने जाते हैं, that happened for me. I mean, the first time when I went to a doctor and the doctor talked in an empathetic manner and solved my concern, I decided कि भाई ऐसा बनना है, I want to become a doctor. Similar thing happens with the teachers. When the teachers are taking care of the children in the classrooms, and they are dealing with the children and helping them improve, the children are bound to take them as role models and imagine themselves as taking their roles in future. So a doctor is a real influencer for everybody around him or her, and not just the patients, but I think the staff, the relatives, everybody looks up to doctors in a manner that the way they behave, the way they talk, everything is extremely influensive. So it becomes that's where comes the role, how the doctor carries himself or herself, and what kind of what kind of persona or personality and positivity is being generated around surrounding a doctor. There are certain people जिनके पास कुछ भी तकलीफ नहीं हो तो भी जाने का मन होता है, so every doctor should aspire to become like that, is what I believe. And the doctor's influence, hospital culture is what I believe, not just the patients and the relatives, because their perspectives are extremely deep. For example, I as a leader, I wish to implement something in the hospital. I don't just take views of my admin team or my, the support team. The first thing which I like to talk about with that implementation is with the doctors, because the doctors deal with everything around them. They deal with the staff, with the patient's perspective, with the family's perspective, and with the relatives' perspectives, and with the other staffs who are dealing with them. So जब हम डॉक्टर का perspective पूछते हैं, जो policies बाहर निकल के आती हैं, they are always very constructive for the hospitals. So doctors का perspective holistic होता है हमेशा, is what I believe, because they are the ones who are dealing with everybody around, right? And that is how they are able to bring to you certain points which, if are involved and imbibed in the policy making, it does wonders. So doctors are true influencers in their own manners, is the key.
So I think influencer is the very right word, because what I eat, the way I dress up, the way I make my public impact, the staff automatically gets tuned to that. If I'm shabbily dressed, I'm not maintaining the decorum, they will say कि हाँ ये तो चलता है, कोई बात नहीं. So I think that's very important, to be a role model to your own staff and patients as well. And rightly said, आपके पास आने से ही बीमारी ठीक हो जाती. That is one thing which we crave to hear, and when we hear that, something reward kind of a feeling, perk is there all the time. So this is very important, to be a good influencer, so that your positive energy does train other people. Automatically, they align into the same page with you. When you talk about involvement, Geetika ma'am, then I think doctors do. I mean, I put it into a word that way. Is the emotional connect important in today's scenario by dealing with the patients and staff? Being a firm leader, still there's something which is an emotional quotient. How
Yeah.
does that matter?
See, eventually, I believe that whatever technology surrounds us, what is going to be most crucial is the emotional connect as humans that we have. And if somebody asks me the qualities of a good qualities of a leader, of a good leader, then emotional quotient comes right in the top 5 of them. So emotional quotient is something which does wonders, and that is something extremely crucial. Now today on our communication networks, we have only WhatsApp, no talk, and chatbots all across the place. People are thriving to talk to somebody. They want to be heard. So the first thing is any doctor who's also a leader must be able to give a patient hearing to somebody, be it a staff of her or his, his, or a patient or a relative. Even if you hear to somebody for a couple of minutes for some time, half of the problems are solved. बहुत बार स्टाफ ऐसे आते हैं बोलने के लिए कि मैडम आप खाली सुन लो, आप कुछ नहीं करो तो चलेगा. We just want you to hear to, and then I feel a little apologetic that there's nobody to hear to people, and sometimes people have so many problems and they know that there is no solution. However, if you are just a patient listener, it's a healing, it's a therapy. So same way, if you communicate effectively with your staff, with your patients, with your relatives, it does wonders. So communication and connect with an emotional empathy is the key to things which I feel that everybody understands. However, implementation बहुत difficult है. अभी patients बहुत बार OPDs में होते हैं, and the doctors are, the patient is talking and the doctor is on phone. They're chatting with somebody else. They're consulting another patient on a chat, and this is how the connect is lost. So when a connect is lost, the key to a good, the good healthcare is a doctor-patient relationship, as we all know. We've always read this. So वो relationship build ही होता है connect से, and connect establish ही होता है when you have an eye-to-eye contact, when you are patiently listening, when we are there in the conversation. Sometimes, we are writing and the patient is talking. We are not in the conversation. अभी families में भी ऐसा होता है. बच्चे बोल रहे हैं and the parents are, on their phones. So when you're not in the conversation, the connect is gone. When the connect is gone, almost everything is lost. So everybody is thriving to have this connect today. And to maintain this connect is something which is, it is the most crucial thing today for a doctor-patient relationship.
So I think I'm just while you were talking, I just remembered an ad very commonly for the dairy milk that the boss gives a dairy milk chocolate kuch meetha ho jaye to his employee, where his son is selected in the medical. So I think that is the connect you're talking about. When your staff wants to give an ear to you, just take out time. Maybe if you're busy at that moment, you can just find out time. Give me half an hour, we'll revert. So that gives a that you are concerned with what is happening in their life. Apparently, you may not be able to help everybody, but that connect is very important. So, you have to be very empathetic. Similarly, with the patients, when you see there's a lined up OPD, then you suddenly start losing finish off worry feeling. So, I think this is a take home. Take as much as work as you can do. Give the quality performance rather than just banging on with people. Because one person who's coming into your cabin is putting all the trust in you. So, just live it in a better way. That is one motto which we should all have as a leaders. And you can always cut short when you talk to them. That is a skill. I think.
Yeah, that you have to balance. I mean, you have to balance. I understand that many times patients would keep talking and talking, and there's a queue outside. But then we have to learn to balance, and it comes out of experience. And it's very important also to respect others' time. Sometimes what happens is there's a queue outside, and the doctor's my time is done, and I'm going out now. So respecting how we are able to respect others' time also. Somebody would have traveled all the way from, say, 100 kilometers just to meet you for 5 minutes. And so respect for time also as leaders, it is very important. I feel that we should, even in today's time, despite of so many people having, I give very precise appointments. I do make sure that I don't make anybody wait more than 15-20 minutes outside the office. And that is how people also start valuing and looking up to you as a great leader. Because when you respect others, you're bound to get that respect out of people. So the respect is something which doesn't come out of position or just a stature or sitting on a chair. It comes with how you practice things, how you behave, and you have to walk the talk eventually. That's how a leader has to be. So
So I think you're very right that the communication strategies are very important, which should be like taught to our MBBS students as well as the postgraduate students. So do you feel there's a need to teach them how to communicate with the patients, and communicating should be effective so that your time loss is not there and the mutual respect maintains. So how do you feel
yeah,
that?
so I'll quickly finish with this because we already talked about that. There's a specific module which has come up in the NMC curriculum now, which is an ATCOM module. Now, this is attitude, communication, and behavior. It is being taught in which communication means, how to break the bad news, how to deal with difficult situations when it comes to counseling the patients and relatives, how to manage, the legal things out of whenever there's a grievances. So this is all being taught in the curriculum now in certain manners. I'm sure it'll improvise as we go ahead. However, what I personally believe, and I'm going to implement this in my say healthcare setting, my medical colleges, that being able to assess the students for this module. When the students are bedside, I believe the greatest doctors is the one who has the great bedside manners. Bedside manners is, how you behave on the bedside of a patient. So when a student is sensitized for this, that you're supposed to have bedside manners and you are going to be evaluated for being appropriate on the bedside, it's going to create great difference. So basically, the module of assessment is like when the student is talking to the relatives, how he is greeting, how he is taking history, how the student is be able to be establishing that emotional collect as we were discussing, and there is a proper set of structured evaluation for this. Then this module can create great things, and we will see a change in the doctors who pass out with this kind of professional and formal training. So communication has come in the module. Now we are trying to bring into the assessment also, so that the students are able to understand the importance and the relevance of communication in the entire education framework. So it's going to happen, I'm very sure. And at least the organizations which are sensitive about it will make it happen in the coming time.
I think a checklist device is very, very important. When, as you rightly said, when the patient enters your cabin, you are with the pen head down, you're not even making a efficient eye contact to that person. Or maybe, how can I help you? Greeting, hi, good morning, come, I'm your doctor. How can I help you? What is the need of the hour? So I think that all things go hand in hand beyond prescription. Because one satisfied patient is going to bring you hundreds more. So your OPD is itself going to grow with effective communication. And as you rightly said, mutual gratitude and respect should never be lost whenever two human beings are talking to each other, maybe the care provider or the patient, either ways. So, I mean, discussing all this, I would like to bounce a little bit of personal bonus closing question, I would say.
Yeah, I think we are
And,
running out of
yeah.
time.
What is the one piece of advice would you would like to give a young doctor who is aspiring to be a leader? Or rather, I would put it that he has to be a leader. There is no skipping from that. So, what is your advice on that part?
I think, yeah, majority of the advices have been covered in the conversation that we did. But yeah, for the young doctors, that develop an understanding of the healthcare holistically, not just your role is going to make it happen. It's everybody in the team who will be joining together for making sure that your vision of treating a patient comes true with the best outcomes. So try to understand everybody's roles. Try to give them the due entrustment and due respect to every teammate, and make sure that you make a holistic team and make the teamwork happen miraculously, and then there's nothing else which will be required.
That's so true. That interesting. I really loved the sentence which you said, put trust into people. You cannot do everything. You have to find out a way where you have to tell them that you are my hands and legs, walk for me and do the work for me. So that is very, very important thing, to trust somebody. I know it's very difficult in the long run, because I still remember it's very hard to improvise your imperfection when you become perfect at certain age. So
That's
that's what happens in all of us, because sometimes I just share with you, Geetika, when I'm operating now, I feel I'm the best person to operate. So letting the fellow operate is something you have to hold your hands, stop cutting, let the other person survive on that, because you are a teacher here. You should always give hands on to the other person also. So many of us are not able to actually improvise and practice this. It's very difficult, easy
very
to say.
very true.
Similarly, during a presentation or something, we always feel that, acha, like in between, like inculcating that, oh, this, add this, add this, add this. So that is where we need to understand that, respect the other person who's trying to speak up, trying to tell you. Let them finish. There is a closed room cabinet where you can sit and say, this is something which I felt you would have added, would have been more effective in your communication to the people or the mob. Why I'm saying that, I'm remembering my teachers, which who gave me the first platform when I presented my first paper or poster in a national conference or somewhere. You are literally shivering from inside. And that is the time when your teacher's eyes meets you and says, no, I'm there, go
Yeah.
on. So that
Well,
go on feel, that connect is something which we need to establish when we are good leaders. I still remember, Geetika ji, when I was standing on the dais and little bit skeptical. You travel from some other state to another state where you are facing all new people, everybody like a different. When you're standing on the podium, the whole situation looks a little different. And then there's certain eyes looking at you. Go on, it's all good, all good. So I think that is what makes you keep running.
yeah.
And here comes the leadership mantra. So, what is your mantra and what you want to give all of us that we should pursue in later on life?
So, I believe that gratefulness is very important as a leader. You have to be, humility and gratefulness. If you keep in your personality, you attract more of success towards you. So, consistent and persistent efforts are, of course, important. However, if you feel grateful for every single thing that you attain because of the entire teamwork that has happened, you attract more and more success towards you. And as I have been telling continuously, that empowering others is my leadership mantra. I mean, I was also in a stage of my journey where, I always love to do things on myself. In the first 2-3 years, presentation बनाना है, नहीं 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 तुमसे नहीं होगा, मैं ही बनाऊंगी.
Exactly.
वहां पे जाके मीटिंग करनी है, नहीं मैं ही जाऊंगी. एवरी मीटिंग आई विल ओनली डू बिकॉज आई कुड नॉट लेट गो थिंग्स. Then, a couple of weeks and months, I felt that I'm stagnant. I'm not able to grow the organization. I'm not able to move ahead. I'm not able to do things that I've been aspiring at. So why is this happening? And then eventually I realized that if I'm going to do everything like this, हम दूसरों को चांस नहीं देंगे, उनको अपॉर्चुनिटी नहीं देंगे, तो इट विल नेवर हैपन. So empowering others is what I have learned with my own things, and then that is how I could grow. And I eventually realized that the teammates who are my core team mates are they feel really very happy when I entrust them with the responsibilities of a higher grade. अभी तक कोई एक पर्टिकुलर काम कर रहे थे, उनको अगर आप एक और काम दो, they are already very good at something, they also want to grow. So if you keep empowering them and giving them, delegating them effectively, it is not just giving them the work, it is about talking to them, it is about mentoring them, sometimes it is about also taking continuous feedback, still they are confident. काफी बार हमें ऐसा लगता है कि इसको क्या सिखाना है यार, सिखाने में इतनी मेहनत जाएगी, मैं खुद ही कर लेती हूँ. लाइक यू वर टेलिंग यू अबाउट द सर्जरी, नो. बट इनिशियल 4-5 बार वो तकलीफ होती है सिखाने में, उनको ग्रूम करने में, उनका फीडबैक्स कंटिन्यूअस लेने में. बट देन इन द 6th टाइम you are done with it. I mean, you are going to the next level now. So this is something which everybody has to understand. So empowerment is my leadership mantra, and gratefulness and humility is which I've always felt like it's the mantra that keeps you marching ahead.
Yeah, I think I would compliment. That's the best thing I find whenever I meet you. That's the best thing. You're humble and that you never lose your ground. That's very important. And that keeps you going. And that is what I said now, when your eyes meet somebody and you feel that I'm comfortable, that is the comfort zone we need to give to each other. And there's always something which is known as retrospective. When I was studying, I felt that this would have been better, that would have been better. ये करते तो अच्छा होता, वो करते तो. So, do you feel that the medical training retrospectively does need some improvisation or something to be added to make it more?
A lot of it, I think, जैसे हमने डिस्कस किया बहुत, हम जब आई थिंक व्हेन वी वर इन स्टूडेंट्स, इट वाज रियली, आई मीन, आई फील दैट कि बहुत कुछ करना चाहिए था, विच आई ग्रेजुअली ट्राई टू डू इन माई ऑर्गेनाइजेशन. दैट्स व्हाई एक्चुअली वी मेड अ मेडिकल कॉलेज, बिकॉज आई ऑलवेज बिलीव दैट ये मेडिकल एजुकेशन ठीक नहीं, मतलब देयर वर सम pitfalls and some lacunae which need to be filled, and that is how no simulation trainings were there when we studied. The first time I remember I started my internship, there came a patient of fall, and my resident told me to, start the treatment, take IV lines, put an RT. I had no clue what he was talking to me. Everything was going above the head because there was no simulation setting. When we used to, I was never taught on a simulator so that I could do a real case scenario when I was an intern. So that was a time when I thought, whenever I got a chance to make my medical college when we started, the first thing I wanted to do, it was my brainchild and my baby, to build a great simulation center so that the student don't feel lost and lack of confidence when they go for the first time to attend the patients. And I am really glad that today we are doing great simulation trainings. So the skills that we are able to impart in the simulation lab gives a lot of confidence to the students to be able to do whenever they are in the real world setting. Similarly, now when we are talking a lot about communication, teamwork, leadership, now I'm trying to make simulation of healthcare team scenarios, wherein this year onwards we are going to work on this, as in there is going to be a team of a doctor, nurse, paramedic, everybody coming together, being given a situation on a simulator. We have a lot of patient simulators in our center, and they are all going to work in a team and manage this patient. And we are going to monitor that how they're talking with themselves, how the doctor and the nurse are discussing the case, how they are making sure that, so this kind of simulation doesn't happen in the country, wherein you are able to work the way a real life scenario is going to be there when you're going to be a doctor in your hospital. The same thing is simulated. And we are going to conduct workshops on these kind of healthcare simulation settings. And I'm really very hopeful that this will bring a great a team approach and team kind of teamwork training for the students. So there are a lot of things which could have been better, but eventually it's a journey. So we are trying to make things happen in our own organization now.
I think that's very correct. Even when I was studying, I think just if somebody who's MBBS student wearing a white apron who's a MBBS, but practically when it comes to take a wind flow, I think it was a difficult scenario. You were all circles around you, how to go about it. So that is right, because I think I have been to your lab, I've been as a trainer as well. So I know that lab, doing it practically, feeling that very much live things are like delivering a patient. Practically on a simulator, but you understand how the things process and how the things go ahead. Like if you are having a rule of triage, you have to make your priorities, but where priority, how to initiate, that is something which these mock drills do start giving into your system. So that's very important thing, very important aspect of improvisation in our medical institutes. So simulation training and a practical training approach is very, very important. Gitika ji running this huge empire, and with family time, with being a boss, with being a friend, there is a word known as balance, which is very, very difficult to do. So how do you try to do everything with so ease without having those stress lines on your face and going about so many things? I mean, every day is an event for you. And I think if I have to watch a Bollywood movie, I think Bollywood, Hollywood combined, the whole day you must be changing roles from morning 6 to evening 6 before you reach home. So, I mean, how do you balance?
Yeah. So, see, of course, sometimes it is challenging and it is difficult. But what I realized is that everybody has got 24 hours. The Prime Minister also has 24 hours, and I also have 24 hours, and my daughter and my son also have those 24 hours. It's the first and foremost thing is, understanding your priorities and trying to make sure that you are able to give time to yourself. अगर आप खुद को थोड़ा सा टाइम देते हो तो सबके लिए टाइम निकल जाता है. Especially to the women who are watching this, I would like to tell. Many times we keep running across the place, around the office, around the houses, but अपने लिए टाइम नहीं है. हर एक के लाइफ में कुछ ना कुछ ऐसी चीजें होती हैं जो that give them real happiness, a real purpose and a real enjoyment and fulfillment. तो उन चीज़ों के लिए थोड़ा टाइम निकालना बहुत important है. Unless you take time for yourself, managing the rest of the time becomes extremely challenging. Be it whatever you like, even reading books or watching movie or chit-chatting with your friend or fitness or exercise. थोड़ा सा टाइम अगर हम आधा घंटा 1 घंटा खुद के लिए निकालते हैं मॉर्निंग में, then it becomes really you're really calmed and you're really able to balance things. And कुछ चीज़ें let go करनी पड़ती हैं. जैसे पहले when I was a first time mother, I was extremely आई स्ट्रेस्ड अपॉन कि डॉटर का कुछ भी मिस नहीं हो जाना चाहिए, ये कंपटीशन वो कंपटीशन हर एक में पार्टिसिपेट कराना है, हर एक में फर्स्ट आना चाहिए बच्चा. देन आई रियलाइज देन it's this way it's not going to work. And eventually I started let going certain things. कभी कभी भूल गए फेस्टिवल के कपड़े पहनाना, तो ठीक है, कोई बात नहीं. You have to stop putting unnecessary stresses on you, and sometimes it's okay. कुछ नहीं भी हो पाया, कुछ नहीं भी हो पाएगा. And sometimes it's very important to seek help. I mean, I have a very supportive family, very supportive husband. We have divided roles. We sit and discuss that, you do this because we want to give time to our children also. And it is extremely important to be able to divide certain roles because they want parents to be around. For example, I'm sitting here right now at 9 o'clock. It is their like dinner time. So it's my husband because my younger one is still very young. He's 5. So he's taking care. So it is important कि सब कुछ अपने पे मत लो. We as mothers sometimes के बच्चों का सब मुझे ही देखना है और वो नहीं किसी को देना है, ऐसा भी हो जाता है. And you don't delegate. So here also delegating it to your family is very important. कुछ काम हस्बैंड को भी देना चाहिए. अपने लिए थोड़ा टाइम निकालना इम्पोर्टेंट है. अपने को जो चीज़ें अच्छी लगती हैं वो बैलेंस ढूंढने के लिए इट्स वेरी इंपॉर्टेंट. इफ़ यू आर देयर फॉर योर ओन सेल्फ, your own body, your own mind is relaxed, everything goes in place. Especially for women, I always tell this that we live 4 lives in a life. Well, adolescence, body के needs different है. Then you're pregnant, your needs are different. Lactation, में of course, gynecologist has up, everything. And then in perimenopausal and menopause, your body needs you. I mean, your body needs yourself to understand your expectations, your requirements, and then give time to it, give adequate nutrition to it, make sure that your body and mind both are in sync with each other. And that is how then everything falls into place. So I make sure to follow my exercise routine religiously, and that is how the energy levels, the everything is to a tune. And I make sure that Sundays I give time to children and I do things with them which we like doing together. If not every day, but Sundays definitely, unless of course there is something urgent. So there are certain rules, there are certain things that you should work in your calendar. And then 24 घंटे में सब कुछ हो जाता है. So it is like prioritizing your things, letting go certain things, delegating certain things, and balancing them.
So sweet, so sweet. So I think we need to, the best crux of the story is this: let go. Try to
Yeah.
understand, and you rightly said your body has got 4 phases. So when you are entering the perimenopause or the premenopause or the perimenopausal or being a menopause, I think your body should understand that this is your limit. And if you want to be unlimited, you want to do everything, start exercising wherever you are, wherever you are placed, so that your body is moving. I mean, keeping yourself in motions with proper diet. And you can see Geetika ji smiling, with that is a smile which is coming from within. So when it comes from within, it has to be here. The peace has to be here in your mind. So for that, I think holistic is the word which I learned is very, very important for you as a whole person. Forget everybody else. Self-love, develop yourself, because if you're a doctor and you're advising somebody, eat right, and that person looks at you and says, look at your extra flab. That is like
Precisely.
you're not practicing what you're telling the person to do. So I think practice your own words is the first thing, but don't push your limits, because some person can run a cross country for 3 kilometers. You can just walk 3 kilometers, or you can just walk a little bit. So a little bit extra every day is going to add to your milestones. Thank you, Geetika ji. It was excellent, excellent to be like heart to heart talking. And as you rightly said, improvise yourself every day. Self love, synchronized. And the best part, what she has highlighted, is delineate. Stress relief karo apna. Tell other people that you can work for me and work more efficiently. Try to tell them what your brain needs and your physical body comfort needs. So I think that was a very, very important session where I learned today that I'll be letting go of many things, trying to hold
Great.
to
My
myself.
job is done.
So I think to people who are listening to us together talking, I mean, we were having, I would like to say that it never felt that we are talking out of the box. We're talking a real life scenario where we need to just rethink. Reboot is the right word. Reboot yourself for the very next day. Start with a new smile, but do take care of yourself, because leaders should be a leaders in every aspect. If you're happy mentally, you're physically fit, your leadership quality, your brain is thinking better, no brain fogging, and your movement is always forward. So Geetika ji, your inputs were very, very, I mean, adding credentials to me and people, audience who have listened. Thank you for sparing
Thank
your
you so
time.
much. It was a pleasure.
Yeah,
It was
same.
fun.
I'm looking forward to more in some other future, some other platform together.
Thank
So,
you so much. Thank you. Good night.
yeah, thank you. A very big thanks to the support team who has been with us, and Sunita Tandulwadkar madam for giving us this opportunity. Our faculty Geetika ji, she is never stopping, unstoppable, and going to flourish more and more, giving us more inspirations. Thank you. Shabba khair. Good night. We
Good
sign
night.
off to see you tomorrow again with another podcast intro. Thank you so much. Good night. Bye bye. Thank you, Geetika ji. Bye. Thank you, support team.
Thank you. Bye. Bye.